Now, today, today we are going to discuss about the muscles of the back. Muscles of the back are the ones which support our body to keep its erect posture. So, let's see, why do we need muscles in our back? We need them to help maintain our posture and to provide movements of the trunk and upper limb. So, they are the main helpers to keep our vertebral column in an erect posture, and they provide smooth movements of the vertebral column and the trunk, and they help us to make the free movements of our upper limbs. We can divide these back muscles into two major groups. They are the extrinsic back muscles and the intrinsic or deep back muscles. These intrinsic or deep back muscles are also called as post-vertebral muscles, which are belonging to the vertebral column. Now we can further divide these extrinsic back muscles into superficial back muscles and intermediate back muscles. Superficial ones are the muscles which produce and control upper limb movements. So they connect the upper limb, they connect upper limbs to the thoracic wall and the vertebral column. Because of them, the upper limbs are connected to the eggshell body. And the intermediate back muscles are the ones which are thought to be involved in the respiratory movements. So they are located in the thoracic cage and involved in the respiratory movements. The superficial extrinsic back muscles, there are 5. Those are the trapezius, this large one, and latissimus dorsi, the one in the below, levator scapulae, this one, and the 2 rhomboids, rhomboid major and the rhomboid minor. So, all these muscles are called as the posterior exoappendicular muscles, and they connect the axial skeleton, primarily the vertebral column, to the superior appendicular skeleton and specifically the pectoral girdle and the humerus. And these are divided into 2 subgroups, superficial and deep. So this this table shows about the muscles and their origin, insertion, and the nerve supply. So the trapezius, which is the largest muscle, originates from the occipital bone, ligamentum nuchae, and the 7 cervical vertebral spines and the thoracic vertebral spines. So it inserts into the upper fibers of the lateral third of the clavicle, middle lower fibers into the acromion and the spine of scapula. Nerve supply is into the is by accessory nerve, and the action is to elevate the scapula and medially pull the scapula and pull the medial border of the scapula down. So the latissimus dorsi muscle, it origins from the iliac crest, lumbar fascia, and the spines of the lower 6 thoracic vertebrae, lower 3 or 4 ribs, and the inferior angle of the scapula. It inserted into the floor of the bicipital groove of the humerus and supplied by the thoracodorsal nerve. It extends, adducts, and medially rotates the arm. The levator scapulae muscle arises from the transverse processes of the first 4 cervical vertebrae and inserted into the medial border of the scapula. So it is supplied by the dorsal scapular nerve and raises the medial border of the scapula. The rhomboid minor origins from the ligamentum nuchae and the spines of 7th cervical and 1st thoracic vertebra and inserted into the medial border of scapula. Supplied by dorsal scapular nerve and act by raising the medial border of scapula upward and medially. The rhomboid major muscle origins from the 2nd to 5th thoracic spines and it inserted into the medial border of scapula. Its nerve supply and action is as same as the rhomboid minor. Now, when the next one is the intermediate muscles of the back. So, as I say earlier, they are deep to the superficial back muscles and they are much superficial to the intrinsic muscles. So, they are very thin and found in pairs in each side of the body. And the main ones are the serratus posterior superior muscle and the serratus posterior inferior muscle. So, apart from them, there are another 2 muscles which are external intercostal and innermost intercostal muscle. So, this innermost intercostal muscle is an incomplete muscle layer which is situated in the innermost layer of the intercostal muscles. And all these muscles are designated as respiratory muscles that cause movements of the ribs during inspiration and expiration. This table shows you some information about those intermediate muscles of the back. So you can see all those intermediate muscles are supplied by intercostal nerves and they originate from most of them are originate from the ribs and inserted into the ribs. So all of them are acted upon helping inspiration and assisting in other inspiratory muscles and increasing the diameter of the thoracic cage during inspiration and expiration. Okay. Then we can go into the deep muscles of the back or the intrinsic muscles or postvertebral muscles. You can see in this picture I have outlines in the red lines. These the red lines remarks the areas from where to where these deep muscles of the back are extend from occiput to the sacral area. And these blue lines indicate at where you can see this at where you can see this deep muscles situated. So, in these deep muscles usually function to maintain the posture of the body and control movements of the vertebral column. So, these muscles extend, as I earlier said, they extend from the skull to the sacrum and they occupies the hollow area on the each side of the spinous processes of the vertebral column. So they form a thick and broad column of muscle tissue which comprise of separate many separate muscles of varying length. So these muscles of varying length make muscle groups. These muscle groups act to uh, act to maintain the posture and control the movements of the vertebral column. And the spines and the transverse processes of the vertebrae serve as the levers which facilitate these muscles actions. So when we talk about when we see a person with a normal standing position, uh, the line of our gravity usually passes through the odontoid process of the axis and the posterior to the centers of the hip joints, and then it passes anterior to the knee and the ankle joints. So uh, when the body is in this position, the greater part of the body's weight falls in front of the vertebral column. So there is a tendency to fall to the front due to the weight of the body. So the that 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 falling is prevented by this the tone and the strength of this post vertebral muscles. That is why these post vertebral muscles are well developed in humans. Because of that, their postural tones is a major factor which is responsible for the maintenance of normal curves of the vertebral column and the erect posture of humans. And also, I have previously said that these muscles are arranged as thick columns of muscle groups. So each individual muscle can be regarded as a string, which is when pulled on causes one or several vertebrae to be extended or rotated or flexed on the vertebra below. So because these muscles have variable length, they have variable sites of origins and insertions. Therefore, the origins and insertions of the different groups of muscles overlap. This causes entire regions of the vertebral column to move smoothly. That is why when we move, when we flex or when we extend our vertebral column, our vertebrae doesn't act separately. They act as one single unit. They act as a smooth single unit to facilitate the movements of our body. So this table shows you how we can roughly categorize the deep muscles of the back, the intrinsic muscles of the back. So we can categorize them according to length. The first one is superficial vertically running muscles. So they include erector spinae, iliocostalis, longissimus spinalis. They are the muscles with longest length, and they start from the sacrum and extend to the rib angles, the transverse processes, and the upper vertebral spines. And the second one is the intermediate oblique running muscles. They include transversospinalis, semispinalis, multifidus, and rotators. They have intermediate length. They start from the transverse processes and runs to the spines. The next one is deepest muscles. They include interspinals and intertransverse. They are the shortest muscles. They run between the spines and between the transverse processes of adjacent vertebrae. So now those are the main muscles you will see in the back of the human body. And splenius is a separate detached part of the deep muscles of the back. This muscle consists of two parts. You can see in this picture, colored in uh, pale blue and yellow, splenius capitis and splenius cervicis. So this splenius capitis part, which you can see here, is arise from the lower part of the ligamentum nuchae and the upper four thoracic spines, and it is inserted into the superior nuchal line of the occipital bone and the mastoid process of temporal bone here. And then this splenius cervicis part has a similar origin from the ligamentum nuchae and the upper four thoracic spines, and then it is inserted into the transverse processes of the upper cervical vertebrae. Then let's see about the nerve supply of the uh, deep muscles. These all deep muscles of the back are innervated by the posterior rami of the spinal nerves. Okay. Then there are some tricky areas which are called the muscular triangles of the back, which are important in clinical aspects. So these are important in clinical settings. One is this auscultatory triangle, because this is the place where you can most easily hear the breath sounds with the help of a stethoscope. So this triangle is bound by the latissimus dorsi, trapezius, and the medial border of the scapula. The next one is the lumbar triangle. This is bound with the latissimus dorsi, posterior border of the external oblique muscle, and the iliac crest. So this is the place where you may see pus emerge from the abscess in the abdominal wall. So these are the two places which are important in a clinical setting. And then there's another important thing uh, which is called the thoracolumbar fascia, or the deep fascia of the back. So it has major two parts, lumbar part and the thoracic part. And this fascia is a thick sheet which forms a strong aponeurosis, and it binds these long extensors of vertebral column to posterolateral surfaces of the vertebral bodies. And then it usually superiorly continues with the deep fascia of the neck and lies deep to the serratus posterior muscles. In this picture, you can see this thoracolumbar fascia has three layers. This layer, which is posterior to the erector spinae muscle, is the posterior layer, and this layer, which is in between the erector spinae muscle and the quadratus lumborum, is the middle layer, and this layer, which is anterior to the quadratus lumborum muscle, is the anterior layer. Then let's go to the blood supply of the back muscles. So when we talk about the arteries supplying the back muscle, we can divide them into regions in order to uh, regions. So back is a very broad area. You can divide them into cervical region, thoracic region, and lumbar and sacral regions. So in the cervical region, there are few major arteries and their branches supply the muscles in the back in that area. So in the cervical region, branches from occipital artery, which is a branch of external carotid, branches from vertebral artery, which is a branch of subclavian artery, branches from deep cervical artery, which is a branch of costocervical trunk. And in the thoracic region, muscles are supplied by branches arising from the posterior intercostal arteries. In the lumbar region, the muscles are supplied by the branches arising from subcostal and lumbar arteries. In the sacral region, the muscles are supplied by the branches arising from iliolumbar and lateral sacral arteries and branches of the internal iliac artery. Now, when we talk about the veins, the veins of the back forms complex venous plexuses. These venous plexuses usually extend along the vertebral column from the skull up to the coccyx. So there are two major vertebral venous plexuses. They are external and internal. So this external vertebral venous plexus lies externally and surround the vertebral column. And the internal one lies within the vertebral canal, but it is outside the dura mater of the spinal cord. So, when we talk about the lymph drainage of the back, all the deep lymph vessels follow the veins. And they basically drain into deep cervical, posterior mediastinal and lateral aortic and sacral nodes. So, if we divide them into regions for the sake of memorization, so lymph from the skin of the neck area drain into the cervical nodes. And from the trunk above the iliac crest drain into axillary nodes. And then from below the level of the iliac crest drain into the superficial inguinal nodes. Then a brief summary of nerve supply of the back. So skin and all muscles are supplied in a segmental manner by the posterior rami of the 31 pairs of the spinal nerves. So you can see in this picture in the yellow color, there are spinal nerves emerging both sides in the from the spinal canals. There are 31 pairs of the spinal nerves. So mainly the posterior rami of the first, sixth, seventh, and eighth cervical nerves and the fourth and fifth lumbar nerves are the ones which supply the deep muscles of the back. But keep remember, these nerves don't supply the skin. But when we consider about the skin dermatomal supply, there is a considerable overlap of skin areas supplied by these nerves. Therefore, if there is a damage or a trauma to a single nerve, that doesn't cause total loss of sensation in that particular area because of this nerve overlapping. Therefore, there will be only a diminished or reduced sensation, not a total loss. Now, let's see some clinical correlations of the muscles of the back. So, you can see there are few things you can clinically find in relation to the muscles of the back. One is the back strains. So this is common in the individuals who participate in sports and heavy weight lifting. So, this occurs in the muscles involved in stabilizing or producing the movements of the spine, particularly the erector spinae muscles. So, it is when there is a imbalance of weight distribution, when you put strain on certain portions of the back muscles, or when it is more likely when using back as a lever. So you can minimize back strains when you use gluteal muscles and lower limb muscles to assist weight lifting. So don't lift weights as shown in this picture. Don't use your back muscles to weight to lift the weight. Bend your knees and use your knee and the gluteal muscles to weight the lift. Then you can avoid getting back strains. And the next one is back sprain. Back sprain is what you call the injury to the ligament tissue, ligamentous tissue or its attachment. So you can see clearly in this picture there is a tear in the tendon or the ligament of this muscle. So this can be a result of a excessive strong contractions in relation to movements in the vertebral column. So this mm, this may be not there may be not any association with a dislocation or a fracture of the vertebral column, and this can occur in a setting of excessive extension or rotation or vigorous exercise or something like that. And the next one is the muscle spasm. So the muscle spasm is a kind of protective mechanism. So your back muscles can go into a spasm after there is a injury or there is a inflammatory process going on in your back muscles or surrounding area. So what you call is a spasm is a sudden involuntary contraction of one or more muscle groups. So this sudden involuntary contraction will be accompanied by cramps and pains. These muscle spasms also can get with exercises and other things. So you can avoid these things by um, warm up and stretch before working out and exercise and strengthen the core muscles, warm up and strengthening the muscles. So you will minimize getting back muscle spasms. Especially transverse abdominis muscles and muscle strengthening is important in preventing back muscle spasms because transverse abdominis muscle is of greater importance when assisting back muscles in keeping body's erect posture. Okay. Now I have added some radiology pictures for you to see. This one here is a MRI picture where you can clearly see some muscles in the back area. So this is how you will see a muscle tissue in MRI. You can see the erector spinae muscle, multifidus muscle, quadratus lumborum, and this is the vertebra and other contents here. And this one is a X-ray film of a normal spine anteroposterior APV and the lateral view. So you can see in the lateral view there is a nice lumbar curvature in here with equal vertebral space, intervertebral spaces without any fractures. And this MRI picture shows straight spine. So you can see uh, there is almost no thoracic curvature in this spine. This is due to back muscle spasms. So you will encounter these kind of similar X-ray pictures in patients with back muscle spasms. So you will be able to identify those patients with clinical examination and with the help of X-rays. Okay. Now I hope you all have get some idea about your uh, muscles of the back, and you can have uh, more knowledge and references on snails clinical anatomy by regions and last anatomy books. And thank you very much.